Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews, the best Nclex prep program in the entire universe, in my opinion. Thank you to all of our channel members. I very much appreciate it. If you would like to pay me for something, you can go to clinicreviews.com and sign up for some of my small group tutoring. I do next gen small group tutoring. You can sign up for that. Mark Klimek also does small group tutoring. You can sign up for his. And you can also sign up for the Clinic Review online on demand. So today we're doing end of life, and I think end of life is actually important for Nclex. And I'm going to end up doing 2 videos. I don't know when I'm going to do the second one, but this is just going to be the first of 2. We have 10 questions to go through today. And I think it's important because the questions, when they're end of life, you may answer them a little bit differently than when they're not end of life, because the outcome is different. Any other time, the outcome is to get better, to improve, to stay the same, at the very least, to stay the same. And end of life, it's comfortable death. So you have to think of it through that lens. Okay. So question 1, a dying client is having difficulty swallowing oral medications. Which intervention does the nurse implement for this client? Ask the pharmacy to substitute IM equivalents for the medications. Ask the provider if the medications can be discontinued or substituted. Crush the pill, open the sustained release capsules, and mix them with a spoonful of applesauce. Does not give the medications and documents unable to swallow. All right, I'm going to read the question again. A dying client is having difficulty swallowing oral meds. Which intervention does the nurse implement? So I'm going to rule out A because I don't want to give somebody shots. My goal is to keep them comfortable, and I don't want to give them shots if I don't have to give them shots. So I'm going to cross off A. B is a maybe. C looks good to me. D is I'm going to cross that off because that's not going to be not going to be my preferred intervention for this patient. I would like to give them their meds if I can. So anyway, I'm going to cross off A and D. So I have to decide between B and C. And this is a pretty common scenario to be in, where you have to decide between 2 medications. So what I'm going to do is I'm going to relate it back to the question itself. So for a dying client who has trouble swallowing meds, I'm going to ask the provider if the medications can be discontinued or substituted. But I'm not going to crush the pill, open the sustained release tablets, and mix them with a spoonful of applesauce. Okay, for a dying client, I'm going to crush the pills, open the sustained release capsules, and mix them with a spoonful of applesauce. But I'm not going to ask the provider if the medications can be discontinued or substituted. All right, I don't know if that helped you, but that helped me because we're talking about a dying client. And C is what I usually do for most of my patients who are, healthy or have a chronic disease, but they're getting better. This is a dying client. And I would rather ask the provider if the medications can be discontinued or substituted for a dying client, because we're not treating, our goal is not to treat chronic illnesses anymore. It's to keep them as comfortable as possible. And if they're having trouble swallowing, as much as I can, I would like to not have to give them pills if I can get an order not to have to do that. Now, if they say, no, we can't discontinue or substitute them, well, then I can maybe crush them, give them with applesauce. But my best intervention for a dying client is to see if I can get any of these meds discontinued. And that's one of the reasons I wanted to do this, is because I wanted you to see how we answer the question differently for a dying client versus a hospitalized client who has a chronic disease, but we're getting better, or post-surgical or something like that. All right. A dying client says to the nurse, I am afraid to die. I did a lot of wrong things in my life. How does the nurse respond? So this is a psych question in a end of life scenario. It's an end of life scenario, but a psych question. So we're always looking for the most therapeutic response. So he says, I'm afraid to die. I did a lot of wrong things. So what's the most therapeutic response? Don't worry, God will forgive you. I'm sure it's nothing to worry about. Tell me more about that, or why. What did you do wrong? Okay, so I'm going to reread it again. I'm afraid to die. I did a lot of wrong things in my life. So I'm going to cross off A because there's no reason to think, there's no reference to God on his part. So plus we don't ever say, don't worry. That's just not therapeutic. I'm going to cross off B. I'm sure it's nothing to worry about. That's not therapeutic at all. So do I want to ask him more? Like, why? What did you do wrong? Was that therapeutic? Or is it better to just say, tell me more about that? So it's definitely more therapeutic to just say, tell me more about that. So C and D are both following up questions. So we're not ignoring what he says, we're following up. But C is an open ended question and D is a closed ended question. So it's just D is, what did you do wrong? So tell me, or just tell me more about that. They can talk about it however they want to. So that's more therapeutic. Question 3, the family of an unconscious dying client realizes that their mother will die soon. The client's children are having a difficult time letting go. How does the nurse respond to the needs of this family? Okay, another psych question in an end of life scenario. Don't be upset. She wouldn't want it that way. She will soon be in a better place. Things will be fine. Try not to worry so much, or this must be difficult for you. So the family is upset that mom's going to die soon. How do I respond? So don't be upset. She wouldn't want it that way. Well, that's telling them how to feel. That's not therapeutic. So I'm not going to pick A. She will soon be in a better place. Again, we're assuming a belief system that they may not have. They may not believe in an afterlife. And so that's not therapeutic because I don't know what their belief system is. C, things will be fine. Try not to worry so much. It's not therapeutic to say, don't worry. It may be, I don't know, things will be fine. That's not particularly therapeutic, but to say, don't worry is not therapeutic. This must be difficult for you. So what I want you to learn is that you can choose answers by ruling out other answers. So this must be difficult for you. That's not always my first choice for an answer, but when all the other answers are clearly wrong, then I'm going to pick this answer. And to say something like this must be difficult for you is sort of a clarification question. I know it's not a question, but it's sort of a clarifying statement. This must be difficult for you. It's kind of acknowledging what they told you, that they're having a hard time, and sort of reflecting that back, kind of clarifying that for them. So this is another example. I've said this before, but when you're doing it, you don't study Nclex questions to learn content. You do Nclex questions to practice strategies, because the right answer is always the right answer because of the other answers. So D is the best answer because A, B, and C are all bad options. Just like in question 2, C is the best option because D is closed-ended and A and B are not therapeutic. So particularly with psych questions, you need to look at all the answers. Don't ever assume just immediately that you know what the right answer is. Look at all the answers, rule out the ones that are not therapeutic, and then look at the kind of what's remaining and choose what's most therapeutic out of the remaining options. The daughter of a dying client says, I don't want my father to be uncomfortable. How does the nurse respond? I don't want my father to be uncomfortable. Okay, do you want to talk to the bereavement nurse? Your father will be closely monitored and cared for. Your father will be kept sedated. We will send him to hospice when the time comes. Okay, the daughter of a dying client says, I don't want my father to be uncomfortable. Okay, so again, a therapeutic response. She's saying, I don't want him to be uncomfortable. I don't want my father to be in pain. So do you want to talk to the bereavement nurse? Well, there's nothing wrong with saying that. But one of the principles for testing is don't pass the buck. If you can do something or say something now, then do that now. Don't pass the buck to someone else. So unless all the other options are really bad options, I'm not going to pick A. I'll pick A if all the other options are really bad options, but A is passing the buck, and I don't want to do this if something else is better. Your father will be closely monitored and cared for. Okay, I don't want my father to be uncomfortable. So to say your father will be closely monitored and cared for. So that's not really addressing the fact that it's uncomfortable, but it is a true statement. Your father will be closely monitored and cared for. So that's a true statement. So it is not passing the buck. So we're going to keep B on our list. So B is better than A. So we're going to cross off A because B is better. Your father will be kept sedated. Well, I don't know that that's a true statement. Your father will be kept sedated. So I can't choose an answer that I'm not sure is true. So I'm going to cross off C because I don't know if that's true. We will send him to hospice when the time comes. Again, I don't know that that's true. That's sort of like promising him something for the future that I don't know is true. Now, I realize B, C, and D are all talking about the future, but B is a true statement. Like, they will be closely monitored and cared for. It's not promising that he's not going to be in pain. It's not promising he's not going to be uncomfortable. It's not even promising how much pain medicine he's going to get. He's just saying we will be closely monitored and cared for. So that is a true statement. Whereas C, I don't know that that's true. D, I don't know that that's true. So again, B, out of all the answers here, B is the best option. And again, I'm teaching you how to choose an answer that's best out of all the options. And I do this a lot, y'all. I do this a lot when I get questions and I'm like, I don't know what the right answer is. So let me look at each one and analyze each one on its own merit. Is it any good? If it's sort of good, is there an answer that's better than that? And then I kind of choose the best answer out of all of them. So I'm going to say this again. I've said it many times. You're not going to automatically know the right answer for every question on the Nclex. You have to analyze them, use your clinical reasoning skills, think what's therapeutic, what's not, what are some things that are okay to say, what are some things that are not therapeutic to say. You want to speak truthfully and so forth. So these are just some strategies for answering questions that you don't automatically know the answer for. A dying client becomes increasingly withdrawn and begins to refuse to eat and drink. What intervention does the nurse implement? So my thought immediately says, well, that's pretty typical. So dying clients do tend to withdraw as their life gets closer to the end, and they often do refuse to eat and drink. So I say to myself, well, that's pretty typical. What intervention does the nurse implement? I'm not sure what I would implement because that's pretty typical. So let me see what's here. Brings in the client's favorite food, maybe. Calls the family to come in right away. Well, no, that's not. They're withdrawn, but that B is out. I don't like that answer. Gives IV hydration. No, I don't like IV hydration at this point. They're dying. As far as I can tell, we're probably not going to do any, significant things. Or D, offers ice chips. Okay. So I like that one. So it's between A and D. So do I think if they're refusing to eat and drink, what is my biggest concern? Well, I want them to stay comfortable. What would be a better thing? Bring in their favorite food, but not offer them ice chips, or offer them ice chips, but not bring in their favorite food. If they're refusing to eat and drink, I think that offering ice chips would be better because ice chips at least helps keep them comfortable. It's not going to hydrate them, but it's going to keep their mouth moist. So they're going to be more comfortable because what is the primary goal at end of life is a peaceful death. It's not to try to get them to eat more. It's typical that they're going to stop eating and drinking at the end. So I don't really need to try to get them to eat. I just want to keep them comfortable. So keeping the mouth moist by offering ice chips is the best option here. And again, sorry to go back to this, but this is different than maybe I would do in a hospital setting where the patient is not dying. If they're like, I don't really like the food you have here, I'd be like, well, what's your favorite food? Maybe we can bring that in. That would be in a typical hospital setting where somebody's healthy and they're getting better or whatever, and they just don't like the food. But this is a dying client, and our goal is peaceful death. So that's why the outcomes and the choices we make here are slightly different than in other settings. All right, 6, which condition, when assessed in a dying client, requires the nurse to take action? Okay, they're dying. Now, when they tell you the client is dying, it is okay to assume that they're a no code. Okay. The only way you would assume that they're a full code is if they tell you they're a full code. So when they tell you it is a dying client, that is your cue to say they're dying and we're not going to resuscitate them. Okay. That's what that means in this setting, or in this type of a question, sort of a keyword. Remember, I've said before, words matter. And the phrase "in a dying client" is a key phrase that says this patient's dying. We're not going to resuscitate him. We want a peaceful death for this individual. Okay. So what requires me to take action? Because there's not a lot that's going to require me to take action in a dying client. Alternating apnea and rapid breathing. Well, no, because I'm going to let them die. So I'm not going to take action with that. Anorexia, which is a loss of appetite. I don't have to take action with that. That's expected. Cool extremities. I mean, their body's starting to shut down. They could very likely have cool extremities. That's not something I have to take action with, or moaning. So moaning is typically a indication of discomfort. And what is our goal? Our goal is peaceful death. That includes, when we say peaceful death, we mean reducing the level of discomfort as much as possible. So we don't want people to die in agony. That's what we don't. A peaceful death is a death that is not an agonizing, horrible, painful death, right? So moaning is what is going to require me to take action in this setting. Again, very different than any other setting. If this wasn't a dying client, I would have to definitely address A and C for sure, and probably B. So I'd have to address all these things if the patient wasn't dying. A dying client exhibits signs of agitation. The Foley catheter has drained 100 mils in the last 3 hours. So normal urine output is 30 mils an hour. So the urine output is okay. And the client's last bowel movement was yesterday evening. What does the nurse do first? So they're agitated. The Foley catheter is draining adequate amounts of urine, and they had a bowel movement last night. All right. A, administer an analgesic, which is pain medication. Arrange for a consultation with a bereavement counselor. Assess the client for impaction. Change the Foley catheter to ensure adequate drainage. Okay, so agitation is often an indication of pain. And it seems to me, reading this scenario, that they're probably not really talking. Otherwise, they probably would have had them say something to me. So they're not talking to me, but they are agitated, moving around. Maybe they can't lay still. Maybe they're pulling at things or whatever. So agitation is an indicator of pain. So certainly A is an option. So administering an analgesic is an option. Arrange for a consultation with a bereavement counselor. Well, that's not addressing the problem now. First of all, I don't know how it would address the problem of agitation, but it's certainly not addressing the problem now. It's passing the buck. And I don't like to pass the buck if I don't have to. So I'm crossing off B for right now. Assess the client for impaction. Well, they just had a bowel movement yesterday, so there's no reason to assess for impaction. Change the Foley catheter to ensure adequate drainage. They're having adequate urine output. They're 30 mils an hour is minimum. They're having over 30 mils an hour, 33, 34 mils an hour, so they have adequate urine output. So based on what I know, and I can't read into this, okay, I only can go with what I know. There's no reason to check the Foley or change the Foley. There's no reason to assess for an impaction. I don't want to pass the buck. Agitation is an indicator of pain, and so I'm going to administer an analgesic. Again, I'm using clinical reasoning and common sense as I'm answering these questions. Question 8, a client dying of cancer is receiving high doses of opioids. In addition, which intervention is the most effective for this client? Okay, a client dying of cancer is receiving high doses of opioids. In addition to the opioids, which intervention is the most effective for this client? Classical music, deep muscle massage, more pain medication, or short light massage? All right, I've already read the question twice, so I'm not going to read it again. But so I am going to interpret this question as being a pain question. Okay, they're getting opioids. The only intervention they're telling us about in the question is opioids, which is used for pain. So even though they didn't say which intervention is most effective for pain, the current intervention is for pain. So I'm going to say, what in addition can I do for pain? I am going to use my clinical reasoning and common sense, and I'm going to interpret this question as a pain question. So does classical music help with pain? Well, it's a distraction, so maybe. Okay, maybe. I don't know what their favorite music is, so maybe they hate classical music, but maybe. Okay, I'm going to leave it on the list. Deep muscle massage. No, I'm not going to do deep muscle massage. That's not an intervention for pain. More pain medication. Maybe, but I don't think that's what we're going with here. I really, they're already getting high doses of opioids, so I don't think more pain medicine is a good option. So I'm going to cross off B and C. Short light massage. All right, so I like that. Classical music or short light massage. So here's what I think when I read this question. I say, what are they really testing me on? My guess is they're testing me on pain management. And they may be testing to see if I understand one of the theories of pain. One of the theories of pain is that pain travels on slower neurons. And touch is a sensation that travels on faster neurons. So if you're in pain, I touch you, I can actually sort of interrupt the pain sensation because you feel the touch more than you feel the pain. So I think what they're testing here is, hey, we're given pain medications, but if we can do massage, light massage, so that we do some touch sensations, which can interrupt some of the pain sensations, we can help address some of the pain. So that's why I'm choosing short light massage. So this is one of the ways they can test you on a pain theory. Okay. It's unlikely you're going to get a question. I mean, you could, but it's unlikely you're going to get a question where it says, what do you know about pain theory? Right. But this is essentially testing pain theory without telling you they're testing pain theory. 9, the nurse is coordinating interdisciplinary palliative care interventions. Interdisciplinary palliative care. Okay. For a dying client. Which goal is the nurse seeking to meet? Avoiding symptoms of client distress. So that I would say, yes, we want to avoid symptoms of client distress. That's true for interdisciplinary palliative care. Ensuring an expedited death. No, that's not a goal. That's not a goal. Meeting all of the client's needs. That's pretty extreme. I try to avoid extreme statements when answering, and that's pretty extreme because I don't see how I can meet all of the client's needs. Facilitating a peaceful death for the client. Okay, I like that one. So I like A and D best. So B and C are out. I'm going to cross off B and C. So is my goal to avoid symptoms of client distress or facilitating a peaceful death for the client? So here's what I want you to see here. When you have a question like this and you like both of the answers, what I always ask myself is one of them a broader concept? So, and I call it umbrella concept. So, like, let's say the umbrella concept is vital signs, right? That's the broader concept, the umbrella concept. And then under vital signs, you have heart rate, blood pressure, respiratory rate, and what's the other one? Whatever the other one is, temperature. Temperature is the other one. Okay, but the broad concept is vital signs. So, like, if they say, what is important to assess after surgery, post-op? Vital signs is one answer. B is heart rate. C is blood pressure. I say, well, vital signs, because that incorporates heart rate and blood pressure, right? Okay. So what I say is one of these a broader term? So is avoiding symptoms of client distress the big idea and facilitating a peaceful death the smaller idea within it, or is facilitating a peaceful death the umbrella principle? And then one of the components of facilitating a peaceful death is avoiding symptoms of distress. Because I would think facilitating a peaceful death is the big umbrella principle. And within that, you want to avoid symptoms of distress. You want them to be comfortable. You want them to be with the family if they want to be with the family. You want to meet with the chaplain if they want to meet with the chaplain. Do you see how facilitating a peaceful death is the big idea? And avoiding symptoms of distress is one piece of facilitating a peaceful death. So I'm going to choose the bigger principle, which is facilitating a peaceful death. And that way that incorporates avoiding symptoms of distress within that. All right, last question. A client diagnosed with lung cancer 6 months ago is now ventilator dependent and unresponsive. The family wants to remove the ventilator and stop antibiotics and IV fluids. What is the best nursing action? Facilitates a meeting between the family and the healthcare team, removes the interventions per the family's wishes, tells the family that removing the interventions is illegal, waits to obtain information on the client's wishes. All right, client diagnosed with lung cancer 6 months ago is now ventilator dependent and unresponsive. So it doesn't say he's dying, but it does tell me that he's probably dying. That's my clinical reasoning. The family wants to remove the ventilator and stop antibiotics and IV fluids. What is the best nursing action? You know what, though, thinking about that, it doesn't tell me that they're dying. It doesn't tell me they're dying. So we've got a very, very sick patient here. Very, very sick, possibly dying. And the family says no more treatments. In fact, not only no more treatments, we want to take them off the ventilator. So facilitates a meeting between the family and the healthcare team. I like A. Removes the interventions per the family's wishes. B is too early for me to make that decision. I don't feel comfortable picking B right now. Tells the family that removing the interventions is illegal. That's false, so I can't pick C. Waits to obtain information on the client's wishes. D. Okay, I like D. So I'm crossing off B and C. So it's between facilitating a meeting between the family and the healthcare team or waits to obtain information on the client's wishes. So it says, what is the best nursing action? So best nursing actions mean I can only do one thing. So if I'm going to wait to obtain information with client on the client's wishes, I'm not going to facilitate a meeting between the family and the healthcare team, which means we go, sorry, too bad. You want that? Nope, not going to do it. Bye. See you later. That doesn't seem very good. Or I'm going to say, okay, well, let's meet together and let's have the healthcare team and you talk about why you're saying this. What information do we need to know on what you're thinking? But we're not going to wait to obtain the client's wishes. See, I'm okay with that because they're unresponsive. And so I'm okay with not waiting to obtain information because if I can facilitate a meeting, that's going to give me information. Now, at some point, we may go, hey, what did dad or mom want? What did they want? I can say that in the meeting. I don't have to wait to have the meeting to do that. So to me, A is the bigger idea even. So I like facilitates a meeting between the family and the healthcare team. That's a better option. If I can only do one thing, that's the one thing that I want to do. Those are 10 end of life questions. I know there are more end of life issues that we can talk about. That's why I'm going to do a second one at some point, probably talking about postmortem care and stuff like that, which you can definitely see on the Nclex. So I hope you have a great rest of your day, and I will talk to you later. Bye.